So, Dr. Lesia, thank you so much for joining us again for the next in our series of dental regulations conversations. Um, since our last discussion, we have a lot of feedback from people who were asking questions about regulations in general in Canada. And the RCDSO elections are now over. But can you give our viewers kind of take a step back a little bit and give us a wider view of how healthcare is regulated in Canada, and then tie that back to dentistry?
So, healthcare is under provincial jurisdiction, which means that it's the provincial government that will draft, approve, enact legislation that relates to healthcare practice. In Ontario and in other provinces, they have what we call umbrella legislation, which talks about how the professions that are regulated, and another phrase that's used sometimes is self-regulated, they have a college or a regulatory authority. And then there will be laws that pertain specifically to the different professions that have this status in the province. So in Ontario, we have the Regulated Health Professions Act. Then we have the Dentistry Act that pertains particularly to dentistry. We have the Medicine Act, the Pharmacy Act, etc. And there are 27 regulated professions in Ontario. So the regulatory authority has to have certain programs, has to have certain a certain composition and committees, and that's in the umbrella legislation, which is the Regulated Health Professions Act. The Dentistry Act in Ontario will set out what the scope of practice is for our profession, what the authorized acts are. So in Ontario, we have a concept of the controlled acts that may cause harm to the public, and they can only be performed by the regulated professionals that have that act according to their statute, or that in some cases, a profession, for instance, medicine can delegate, physicians can delegate their controlled acts to other types of professionals. Dentists can't do that. Dentists are able to give an order for scaling and root planing to a dental hygienist, or an order for restorative procedures or orthodontic procedures. And there are also other procedures that we can authorize respiratory therapists and registered nurses to perform. Right? So we provide orders to them to do those procedures, but we can't delegate. We can't let somebody else do a controlled act that a dentist could do. So that's the kind of information that will be found in the Dentistry Act. And in the Regulated Health Professions Act, the Minister of Health oversees the operations of the regulator and how well it performs its functions.
So, on a very basic level, how do everyday dentists, somebody who's just graduated from university or completed the equivalency process, how would they start to relate with the regulatory bodies?
Their first encounter will be when they are registered, but if they have completed a dental program at an accredited school, they will have had a course in ethics, professionalism, and jurisprudence. Internationally trained dentists will also have to take a course in ethics, professionalism, and jurisprudence that's given by the regulator as a requirement for registration in Ontario. After that, they have to renew their registration yearly. And depending on what their scope of practice is, depending on whether they require a facility permit in order to administer sedation and anesthesia in their practice, whether they want to install a dental CT scanner, there will be processes to have their facilities inspected for compliance with those standards of practice. So those will be usual. And sometimes a dentist will have a complaint filed by a patient, right? So they would receive notice that there's been a complaint filed, and they will have to make a response to that complaint. They may also encounter a different regulatory authority. For instance, if they have dental hygienists working in their practice, either if there's a complaint filed against a dental hygienist to their college, which is called the College of Dental Hygienists of Ontario in our province, or if their dental hygienist has been selected for their quality assurance program's peer review, the quality assurance assessor from the College of Dental Hygienists of Ontario may come to a dentist's office. They're not reviewing the dentist's practice, but they're reviewing the clinical practice of another professional that works in the office. So, often the dentist will have questions. Well, why is there somebody from a different college coming to our office? And what are my responsibilities? Well, the Regulated Health Professions Act actually answers that question. Everybody has an obligation. Every regulated professional has to cooperate with somebody from their own college, their own regulatory authority, or any other regulatory authority. You have an obligation to cooperate so that they can fulfill their function. So those might be some examples of how a practicing dentist relates to or has encounters with the regulators.
So, what would be your advice for a dentist who's just about to enter the market and is possibly worried about the regulatory bodies and how they interact with them?
Oh, my advice really would be don't be afraid, right? The dentists who work at the colleges, the larger colleges that employ dentists on their staff, and the smaller colleges, if you're in let's say a maritime province, and they don't have that many people on staff, and the dentists who are involved are on the councils. They're dentists just like you. Maybe they don't practice anymore. They certainly would have practiced at some point. They understand what it's like to be in practice, and they understand what it's like to be afraid of the unknown, right? But I'm here to say, because I've worked in a regulatory body, that really we're just dentists who want to do the best that we can to help you succeed in practice. And I think that that's what I would say to dentists who are afraid to call their college. Don't be afraid to call a college, right? The dentists who are involved in that regulatory work will want to help you as colleagues. And if you can't find the information about what the rules are on their website, you can contact somebody at the college, whether it's the first point of contact, which is the receptionist, whether it's info at whatever the college's domain name is, asking where to find a particular standard of practice, asking whether they offer any courses in record keeping, all of that stuff. Try to avail yourself of the resources that they've put together for you. And if you can't find them, then there's somebody who's going to be happy to tell you where to find that information. I guess it's easy for me to say, but I feel an obligation to say it because I want dentists to know what the rules are. I want them to know where they can find it. And I want them to know that there's a human, face at the other end of that phone line or at the other end of that email that wants them to succeed, because I know that to be true.
And are there any specific areas where uh, dentists would should be a little bit more cautious or typically have issues with the regulatory bodies, especially colleges?
I think
Mhm.
admitting that you don't know something, admitting that you've made a mistake, or you could have done better to provide care to the patient. I think that's hard for people, because we're so invested in our education, and we know that we have a professional reputation in the community, and we are afraid of the regulatory authority because they have the power to take away our license. Well, that's not really going to happen. There are disciplinary cases, there are revocations, but by and large, you know most dentists, if you have a complaint filed against you, you will continue to practice, right? So what the colleges, they have a mandate of protecting the public. What they want to see is that that's what you're concerned about too, right? They want to see somebody who's a professional, and being a professional does mean knowing what your limitations are, knowing when to refer. And if you didn't refer and you did something that was more difficult than you should have attempted, and there was a problem, you dealt with that problem appropriately, which may include referring later, which may include telling the patient what happened, which may include telling the college, I could have done a better job. And yes, I'm willing to take a course to fix, so that this doesn't happen to another patient. I think the humility of admitting that you don't know everything is really my next bit of advice. That the college, if they see that you are concerned on a human level for the outcome, as far as your patient is concerned, that you're willing to admit that you can learn something, I don't think there's anything to fear after that.
So that's all we have time for today. Thank you again, Dr. Lesia, for joining us. And look out for much more content from Dr. Lesia as we dive into topics such as teledentistry and how to work as a team in dental clinics in Ontario and in the rest of Canada.